Good afternoon, everyone. Thank you for being here. Today, we're going to dive into a topic that's incredibly important for your daily life and overall well-being: muscle health. We often think of muscles just for movement, but their role is far more fundamental. We'll explore the different types of muscles in your body, understand how various health conditions can affect them, and most importantly, discuss practical strategies to keep your muscles strong and healthy throughout your life. This isn't just about looking strong, it's about maintaining your independence, vitality, and preventing serious health issues as we age. Let's start by understanding the three main types of muscles in your body. First, we have skeletal muscles. These are the ones most of us are familiar with. They're attached to your bones, and you control them consciously to move your body, whether you're walking, lifting, or reaching for something. Next is cardiac muscle, which is truly unique. This is the muscle that makes up your heart. It works tirelessly, day and night, pumping blood throughout your body, and you don't even have to think about it. Finally, there's smooth muscle. These muscles are found in the walls of your internal organs like your stomach, intestines, and bladder, as well as in your blood vessels. They work automatically to perform vital functions, like pushing food through your digestive system or controlling your blood pressure. While all three are essential for life, and often taken for granted, maintaining their health is paramount for independence, vitality, and preventing serious health issues as we age. They respond very differently to illness and injury. Our main focus today will be on skeletal muscles and a significant problem called systemic muscle loss. This isn't just about losing a bit of muscle here or there. Systemic muscle loss means the widespread thinning and shrinking of your skeletal muscles throughout your entire body. It's different from, say, when one of your arms gets smaller because it's been in a cast. That's called localized muscle loss. Systemic loss affects all your muscles. Why is this so important? Because this profound loss of muscle significantly increases frailty, makes everyday activities like climbing stairs or carrying groceries much harder, and can severely impact your independence and overall quality of life. It's a strong indicator of increased hospitalizations and can even predict a shorter lifespan. So, understanding and addressing it is crucial. One of the key health conditions that drive systemic muscle loss is chronic heart failure, or CHF. While CHF primarily affects your heart's ability to pump blood, it can also lead to a serious condition called cardiac cachexia. This is a severe form of body wasting where you experience significant loss of not just skeletal muscle, but also fat and overall body weight. Think of it as extreme weakness and shrinking of the body, largely due to the heart condition. It's important to understand that cardiac cachexia isn't simply muscle shrinking because you're less active, although inactivity does contribute. It's an active, systemic process, meaning your entire body is affected, driven by the disease-related inflammation and metabolic disruptions caused by heart failure. Let's look at how CHF actually causes this muscle loss. The first way CHF impacts your muscles is through reduced blood flow, or what doctors call hypoperfusion. When your heart is weak, it can't pump enough oxygen and vital nutrients to your skeletal muscles. Imagine your muscles being starved. Without this essential fuel, they can't function properly and begin to break down. The second major factor is systemic inflammation. CHF triggers a chronic, low-grade inflammation throughout your body. Your immune system, responding to the stress of heart failure, releases tiny warning signals called cytokines. While cytokines have important roles in chronic conditions like CHF, they unfortunately also send messages to your muscles, telling them to waste away. So, instead of helping your body, these signals start to eat away at your muscle tissue. Beyond blood flow and inflammation, heart failure also affects your muscles through neurohormonal activation. Your body has powerful emergency systems, often called your fight or flight response, that kick in when you're stressed or sick. In heart failure, these systems, along with others that control blood pressure and fluids, can become overactive and stay on high alert. When they're constantly activated, they release chemicals that tell your muscles to waste away. Another significant factor is metabolic abnormalities. People with CHF often experience anorexia, which in a medical context means a significant loss of appetite or desire to eat. This, combined with malabsorption, where your body struggles to properly take in nutrients from food, often due to gut congestion, creates a negative energy balance. Essentially, your body isn't getting enough fuel, so it starts to break down your muscle for energy. We're also learning a lot about the gut-muscle axis, meaning there's a strong connection between the health of your gut microbes and your muscles. An imbalance can contribute to more inflammation and muscle loss. Finally, the very symptoms of heart failure contribute to muscle loss through physical inactivity. When you experience fatigue and shortness of breath, it's natural to reduce your physical activity. This leads to what's called disuse atrophy, which is simply muscles shrinking and weakening because they're not being used. This problem then compounds the issues caused by blood flow, inflammation, hormones, and metabolism. For someone with significant muscle loss, everyday tasks like climbing stairs, carrying groceries, or even just getting out of a chair can become extremely challenging, further contributing to a sedentary lifestyle. It truly becomes a vicious cycle where symptoms lead to inactivity, and inactivity worsens the muscle loss. So, what can we do about this? Combating muscle loss in CHF is definitely a team effort, requiring a multi-pronged approach and always being medically supervised. It's crucial to work closely with your healthcare team. We'll now look at the key pillars of this strategy, which include specialized exercise programs, optimizing your nutrition, making sure your heart medications are working effectively, and managing any other health conditions you might have. The first and one of the most powerful tools is cardiac rehabilitation and tailored exercise. This isn't just general exercise, these are supervised programs specifically designed for people with heart conditions, adapting to your capacity. The goal is to preserve and build your muscle strength while also significantly improving your heart and blood vessel health. Key principles include progressive overload, which means gradually increasing the challenge to your muscles over time, for example, by doing slightly more repetitions or adding a little more weight when you're ready. We also focus on compound movements, which are exercises that work multiple muscle groups at once, like squats or push-ups, making your workouts more efficient and functional. For older adults, power training. Exercising with speed, like quickly standing up from a chair, is also crucial, as the ability to generate power declines faster with age and is vital for preventing falls. Even moderate aerobic activity, like brisk walking, greatly benefits your heart and indirectly supports your muscle health. Let's really focus on resistance training, also known as strength training, because it's truly your best defense against muscle loss, especially age-related muscle loss called sarcopenia. Resistance training means working your muscles against a force or weight. This could be your own body weight, resistance bands, or light dumbbells. It's incredibly crucial because it directly stimulates your muscles to grow and get stronger. When you lift weights or use resistance, you create tiny changes in your muscle fibers, which then trigger a powerful repair process, literally making your muscles bigger and stronger. It also helps preserve those important, fast-twitch muscle fibers that are key for power and quick movements, like getting up from a chair or catching your balance to prevent a fall. Plus, it improves the communication between your brain and muscles, making them work more efficiently, and helps your body manage inflammation and produce energy better within the muscle cells. So, how do you do resistance training safely and effectively? Here are some general guidelines. Aim for 2 to 3 sessions per week, allowing at least a day of rest in between for your muscles to recover. The intensity should be moderate to high, meaning you should feel your muscles working hard and feeling fatigued after about 6 to 15 repetitions of an exercise. Start with just one set per exercise, and as you get stronger, you can gradually increase to 2 or 3 sets. Focus on multi-joint exercises like squats, lunges, or push-ups, as these work multiple muscle groups at once and are more functional for daily life. The key is progression. As you get stronger, gradually increase the challenge by adding a little more weight, doing more repetitions, or adding another set. Most importantly, always prioritize proper form over lifting heavy weights to prevent injury. And remember to always start with a light warm-up and finish with a gentle cool-down. The second pillar for fighting muscle loss is smart nutrition. What you eat provides the fuel and building blocks for your muscles. It's essential to get enough protein, as it's critical for muscle building and repair. Make sure you're including protein sources like lean meats, fish, eggs, dairy, or plant-based options like beans and lentils with each meal. Pay special attention to essential amino acids, particularly one called leucine, which acts like a signal telling your muscles to grow. You also need sufficient calories overall, so your body doesn't break down muscle for energy. Beyond general protein, talk to your doctor or a dietitian about specific nutrients. Vitamin D is crucial for muscle strength and balance, and deficiencies are common. Creatine and omega-3 fatty acids are also supplements that, under medical guidance, can offer benefits for muscle health and strength, especially in conditions like CHF. The third and fourth solutions involve medical management. First, optimizing your CHF medications is vital. Your doctor might prescribe various medications, like ACE inhibitors, beta blockers, SGLT2 inhibitors, or MRAs. These are designed to make your heart stronger and work more efficiently. By improving your heart's function, these medications indirectly reduce the widespread body signals that lead to muscle wasting. They essentially take your body off high alert and improve blood flow, both of which protect your muscles. Second, it's crucial to manage any other health conditions you might have, often called comorbidities. Conditions like diabetes, kidney disease, or even thyroid problems can contribute to muscle loss. By effectively managing these conditions with your doctor, you create a healthier environment for your muscles and reduce additional stressors on your body. Now, for some good news. Beyond the impacts of disease, your skeletal muscle actually has a remarkable capacity for repair and regeneration. This amazing ability is primarily driven by specialized muscle stem cells called satellite cells. Think of these as your muscle's very own repair crew or reserve cells. They usually just sit quietly on the surface of your muscle fibers, waiting. But when your muscles are injured, perhaps from a hard workout or a strain, these cells wake up, multiply rapidly, and then join together to fix the damaged muscle or help it grow bigger and stronger. However, it's important to know that in conditions of chronic illness or advanced age, the function and number of these repair crew cells can be impaired, making effective muscle regeneration more challenging and contributing to overall muscle loss. While chronic diseases are major drivers of muscle loss, aging itself also leads to a progressive decline in muscle mass and strength, a condition known as sarcopenia. This age-related muscle loss is a complex process influenced by several factors: reduced nerve signals reaching your muscles, changes in hormones like testosterone, a decrease in how efficiently your body builds new muscle proteins, and that persistent low-grade inflammation we discussed. Sarcopenia significantly increases your risk of falls, overall frailty, and metabolic problems, which is why lifelong physical activity and good nutrition are so vital as we age. Furthermore, sarcopenia is often accompanied by myosteatosis, which is literally the infiltration of fat within the muscle tissue. Imagine a beautifully marbled piece of meat, that's fat woven throughout the muscle. In people with myosteatosis, fat starts to build up inside. The muscle itself, making it less efficient and weaker, even if the total amount of muscle hasn't drastically changed. Now, what about the other two muscle types, your cardiac and smooth muscles? While skeletal muscle takes the brunt of systemic muscle loss, they are affected differently. Your cardiac muscle, the heart itself, can undergo significant changes. Initially, in conditions like CHF, it might thicken, which is called hypertrophy, as it tries to compensate and work harder. However, in advanced stages of severe CHF, the heart muscle can actually thin and weaken, which is called atrophy, further impairing its pumping function. As for smooth muscle, found in your organ walls like your gut and blood vessels, it's generally more resilient to widespread loss in systemic wasting conditions. Instead, it primarily experiences dysfunction, meaning it doesn't work as it should. For example, in diabetes, nerve damage can lead to gastroparesis, which is delayed stomach emptying, causing symptoms like nausea, vomiting, or feeling full very quickly. This resilience is partly due to its unique cell properties and its main role in maintaining tone and involuntary contractions, making it less prone to the broad breakdown signals that affect skeletal muscle, unless there's severe lack of blood flow. Why do smooth muscles malfunction, and can they recover? Their dysfunction can stem from several common causes. Electrolyte imbalances, like low potassium or calcium, can directly disrupt their contraction. Neurological disorders, such as nerve damage from long-standing diabetes or Parkinson's disease, can interfere with the nerve signals telling smooth muscles what to do. Hormonal imbalances, like an underactive thyroid, can slow down gut motility. Inflammatory or autoimmune diseases can directly affect smooth muscle, and certain medications or toxins can interfere with their function, for example, opioids causing constipation. Lastly, ischemia, which is a lack of blood flow, can cause smooth muscle cells to become dysfunctional or even die if severe. The good news is that smooth muscle dysfunction, especially from acute causes like an electrolyte imbalance, can often be rapidly reversed by correcting the underlying problem. However, if it's due to a chronic disease, improvement will be gradual and linked to managing that long-term condition. If the lack of blood flow is severe or prolonged, it can lead to permanent damage through a process called apoptosis, a programmed cell death, or lead to fibrosis, the thickening and scarring of tissue, much like a scar on your skin, permanently affecting organ function. Let's now address something frequently confused with muscle issues, a hernia. A hernia is fundamentally a structural defect or opening in the skeletal muscle and facial layers of your body wall. Think of these facial layers as tough, connective tissue wrapping that surrounds your muscles and organs, holding everything in place. With a hernia, an internal organ or tissue can push through this opening, creating a noticeable bulge. It's crucial to understand that a hernia is not primarily a smooth muscle issue, nor is it simply general muscle weakness. It's a structural breach. While a hernia often begins with a weak spot in the tissue, it progresses to a true opening. Because it's a structural defect, exercise generally cannot fix or close an existing hernia. It usually requires surgical repair. However, exercise is incredibly valuable for prevention by strengthening your core muscles before a hernia develops, and it's essential for post-surgical rehabilitation to support the repair and build overall core strength. It's also important to know that not every bulge you see or feel on your abdominal wall is necessarily a hernia. Many other conditions can cause a bulge, where the underlying issue is muscle weakness or separation, but without that specific hole or defect that defines a true hernia. A common one is diastasis recti, which is a separation of your six-pack muscles along the midline, often seen after pregnancy. It's not a hole, but the connective tissue is stretched and widened. This can often improve with specific deep core exercises. Other causes could be a lipoma, which is a benign fatty lump under the skin, a hematoma, or collection of blood, or just generalized abdominal wall laxity, which is overall weakness of your abdominal muscles. Of course, any new or unusual lump should always be checked by a doctor, as it could also be a tumor. So, if you suspect a hernia, how does your doctor diagnose it? The primary method is a physical exam. Your doctor will palpate, or gently feel, the bulge. They might ask you to cough or strain. This is called a Valsalva maneuver, which is like taking a deep breath, holding it, and then bearing down, similar to what you might do during a bowel movement. This action temporarily increases pressure inside your abdomen. If a hernia is present, your doctor will likely feel a distinct hernia impulse, a sensation of the internal contents pushing against their fingertips as they momentarily protrude through the defect. They can often also feel the precise edges of the opening and may even be able to gently push the protruding contents back inside, which is called reducing the hernia. While a physical exam is often enough, imaging studies are crucial in some situations, especially if the exam is unclear, if the hernia is very small, or for patients who are obese. Common imaging tests include an ultrasound, CT scan, or MRI, which can visually confirm the presence of the defect and what's pushing through it. To summarize, remember these key takeaways about muscle health. Your muscles are incredibly vital, far beyond just enabling movement. They're fundamental to our independence, vitality, and overall well-being, especially as we get older. Systemic skeletal muscle loss is a serious concern, often closely linked to chronic illnesses like heart failure, but the good news is, you can fight back. This involves a multifaceted approach. Prioritize appropriate exercise, especially resistance and power training, which are crucial for building and maintaining muscle. Fuel your body with a nutrient-rich diet, focusing on adequate protein and essential vitamins. Work closely with your healthcare team to ensure you receive optimized medical care, effectively managing any chronic diseases and medications. Remember the mind and body connection. Reduced mobility can affect your mental well-being, so don't hesitate to seek social support and mental health interventions if needed. Ultimately, being proactive with timely intervention and consistently following a tailored regimen of exercise, nutrition, and medical care is one of the most effective strategies for preserving your muscle strength and overall physiological function throughout your life. Thank you.